Done HSG test and you were told you have blocked fallopian tube that naturally stops you from getting pregnant. And then you begin to feel like everything has just started crashing. All your hopes are gone. The ability to get pregnant naturally is no more there. Hey girlie, I want you to relax. Relax and listen to me. If you're a follower of this page and you understand that when I say relax, it's not just an English word, I really meant relax. It means motivation, it means something. Why did I say relax? It's because we have remedies, we have solutions to fallopian blocked tubes. Don't put it so hard on yourself, girl. So I'm going to be telling you the remedies and then the different options you need to treating blocked tubes if it's causing you delay in conceiving. But the first thing we need to understand is, why is your tubes blocked? Why are those tubes blocked? What has blocked that tube in the first place? And the thing is that most times blocked tubes doesn't even have symptoms. It's gonna be there, but you won't know you have it. It can only be coincidentally seen when a woman goes for the HSG test. You know now. Yeah, many times she doesn't have symptoms. Except is one thing that is causing, and I'll tell you in this video. So why do you have blocked tubes? Why do women develop blocked tubes? The first common cause of blockage of a woman's fallopian tube is when a woman have a sexually transmitted infection or pelvic inflammatory diseases, the one you know as PID in the past or presently. Because what that does is when a woman has the infection that has affected her tubes, it causes some form of scarring. So those scarring has formed some bands that has blocked her tubes. I'm not being judgmental. I'm not saying if you have sexually transmitted infection, probably in the past or presently, you should be punished for it. No, that's not where I'm going to at all. I'm just trying to educate you on the different causes why your tubes are blocked. So if you have had cholera, chlamydia, or they have diagnosed with pelvic inflammatory disease or vaginal discharge that was causing severe lower tummy pain, and then you were diagnosed with pelvic inflammatory disease, which is PID, then later in life it can put you at risk of blocked tubes. That is a known fact. The second causes of your tubes being blocked is endometriosis. Some of you have heard about endometriosis. Probably you must have gone to scan and you were diagnosed of endometriosis. Endometriosis happens when the normal lining of your uterus, your womb, that place you normally menstruate from, will now go and be found in another part of your body. And when that same lining of your womb, that type of line, is found in your tube, it can cause tubal blockage. And these are the ones that cause severe pain. So if you are having a very serious pain during your menses and at the same time you're struggling to get pregnant, the number one mistake you do is always assuming. Don't just assume that this is a normal menstrual pain. No. Go for tests, go for investigation, because they might just do a HSG test to be found that you have tubal blockage, which can be caused by endometriosis. The third reason why a woman can have a blocked tube, if she has had surgeries in the past on her tummies or on her pelvis. So if you have had surgery in the past, that may also form scars around your tubes and cause blockage. And then another reason you need to know is that some people are born with it. Yeah. Some people are born with very narrow and blocked tube. And then there's nothing they can do about it. So these are the common causes that you need to know. Now over to the remedy. How do we treat it? Some of you say, Doctor, I have blocked tubes. What do I do? Number one is, how many of the tubes are blocked? If it's only one of the two that is blocked, you still have a very good chance of getting pregnant. So with just one open tube, you can still get pregnant. The other factor is, what kind of tubal blockage do you have? Now, when it comes to tubal blockage, there are two types of tubal blockages. There is a blockage that happens in the front end, and there is a blockage that happens at the back end. If you did a HSG and you were told that your tubal blockage is at the front end, then you still need to be a bit careful, because during the process of that HSG test that they were doing, Sometimes as a reaction to the dye that they will inject and the pain and everything, your tube can just squeeze, like temporarily, and when it squeezes, that dye will not pass and they will interpret it as tuber blockage. This only happens when they told you that your tube blockage is at the front end. So because your fallopian tube temporarily squeezed itself at the process of the HSG procedure and the dye could not pass, they have wrongly interpreted it as a blockage. If your HSG test results say that you have a blockage at the front of your tube, the front part is the part that is very close to your womb. If that is the case, you may need to maybe reconsider or trying to repeat the test. I'm sorry it's very uncomfortable, but you may have to repeat it for clarity. Except it was done in a specialized center. Because in specialized center, what we do is that before we do that HSG test, there's something we put in the tube to prevent squeezing from that reactions. We won't misinterpret any results. Yeah. Now, if your own blockage was at the back of your tube, that's the part that is close to your ovary, where the tube will pick the egg, then the result is accurate. That one will be a confirmed blocked tube. Now, what are the remedies? If it is a front blockage, like I said earlier, there is still a chance that we might be able to pass thin wire through the tube and try to release the blockage depending what it is. But if it's a blockage of the back, then you will have to go ahead to get my tuber blockage, because hardly do they unblock that one. I mean, hospitals. This is where you need me. This is when you need Dr. Amaka and Daniel. Dr. Amax, this is when you need my tuber blockage herb. That is the fact. However, the first one I said is not really 100%, because you can actually go and flush it, it blocks back again. The more you see your period goes through there, it blocks it back too. So that first one is a thing of chance. It may work, it may not work, but the second one is a guarantee. So if you have done the procedure of trying to flush out the blockage and you keep having same issues, what are you waiting for? Why don't you try out those herbs? Those are natural remedies, you know. You don't need any surgery for that when you have me. No. You don't have to consider doing IVF too. I always advise IVF when you have exhausted all options. All options. Okay? This will be the end of our video. See you on my next video. If you like what you see, please kindly click on the follow button, like, comment, share. Love you guys, my girlies. See you on my next video. Bye.